Hey PLABers, this is your PLAB partner with a few more questions to stimulate your thinking. Keep learning and improving, reduce confusion and gain clarity. A 32-year-old woman has been recently spending a lot of money on buying clothes. She goes out almost every night with her friends. She believes that she is smarter than her friends, so she should choose a restaurant for eating out. Well, she also has periods of very low mood. What is her diagnosis? So this patient has a bipolar disorder. There is a lot of description of symptoms of being very high and feeling elated, which will be consistent with mania, but she is also having periods of low mood, which would be periods of depression. So with having features of mania and depression together would fit the diagnosis of bipolar affective disorder. Borderline personality disorder can have instability of mood, self-image and functioning. The term dysthymia is used for chronic depression. 45-year-old man keeps having intrusive thoughts about having dirt under the bed. He can't avoid thinking these thoughts. If he tries to resist, he starts having palpitations. What is the most likely psychiatric diagnosis? It will be obsessive compulsive disorder. It's not a OC personality because it's affecting him significantly. There are no hallucination delusions. Hence, this is not schizophrenia. There are no features of phobia or panic disorder. A 37-year-old man who had served in the army presents with feeling low and a lack of interest in enjoyable activities. He doesn't feel like reading the news or watching movies as he believes there is violence everywhere. What is the most appropriate first-line therapy? So the answer is CBT. This patient has served in the army and must have previous traumatic experiences and now has post-traumatic stress disorder. Citalopram is an SSRI and Lofepramine is a antidepressant. Now chlordiazepoxide would be a sedative and desensitization would not work because that is used for minor neurotic disorders. So he needs talking therapies in the form of cognitive behavioral therapy. 37-year-old lady strongly believes that a famous politician has been sending her flowers every day and is in love with her. However, this is not true. What is the most likely diagnosis? This is a form of erotomania. You can think this is grandiosity, but in that case, a person has a very high ego and very unrealistic beliefs of being quite superior. Tricho-tillomania is pulling out hairs compulsively. Kleptomania is an urge to steal. Pyromania is an urge to set fire. Erotomania is a false belief that someone is loving them. A 65-year-old woman who is depressed after her husband died of cancer 2 months ago was given amitriptyline. Her sleep has now improved for the last 3 weeks and she wants to stop medication, but she still speaks about her husband. What is the next step in management? So for this patient, we know that amitriptyline was given and has made some improvement, but her symptoms of depression are still persisting. The correct next step would be to continue amitriptyline because it has already shown some benefit. During bereavement, depression is a important feature, and if antidepressant has worked, you would continue that for at least 6 to 9 months before withdrawing it. Although commonly you would have used other antidepressants, but TCA and antidepressants are still being used. There is no role of antipsychotic medications. Counseling alone will not help. A 64-year-old man has recently suffered MI and is on aspirin, atorvastatin and ramipril. He has been having trouble sleeping and has been losing weight for the last 4 months. He doesn't feel like doing anything he used to enjoy and has stopped socializing. He says he gets tired easily and can't concentrate on anything. What is the most appropriate treatment? Okay, the answer is Citalopram. This patient has symptoms of depression and Citalopram is the appropriate antidepressant in patients with ischemic heart disease. The other drug that you can sometimes use as an antidepressant is sertraline. Yes, it is always good to refresh the topics that you found tricky. Spend a few minutes reading around those topics that you know less about. Finally, guys, leave a comment or press the like button to encourage us to upload more videos like these.